Hey everybody, this is Dr. Justin Craighead, prosthodontist and periodontist. We are here today to demonstrate Dr. Wadhwani's technique for pre-cementing crowns. As we know from all of the recent literature lately, that cement or excess cement around an implant crown is one of the top causes of implant failure or peri-implantitis. So there's this really easy technique that everybody should be using, and we're going to show you today here in this video. For the sake of demonstration purposes, we have an abutment here in this typodont and a crown that's already been fabricated that fits on the typodont. So similarly to if you were placing this in the mouth, we have it on the typodont already, and we're going to show how to pre-cement this. So what we want to do today is create a jig to express most of the cement out prior to actually cementing. So what we do is we take our restoration here and a small piece of Teflon tape. And this is about the trickiest, most time-consuming part of all of it. You're going to get your Teflon tape and you're going to gently pack a thin layer inside of the restoration. And what this is going to do is it's going to act like a dye spacer or create a little bit of cement space in that area there. It likes to pull a little bit, so it takes a little bit of work, and you can use any kind of instrument you want to really get that in there. There we go. So now we've got a small layer to act as a cement spacer. Then we're going to get our blue mousse here, or any kind of bite registration material. Fill up the inside of our restoration with that material. A little bit of excess is always helpful. And then we're going to grab something, either a wood stick, a micro brush, something to put inside just to act as a handle. And so we have the blue mousse setting inside of the restoration with a small amount of spacer, which in this case is the Teflon tape. We'll give this just another minute. Okay, so now that our bite registration material has set, we can go ahead and remove the crown from it. And what you have here is an analog or a duplicate of the abutment right here, which is going to be in the mouth. So we can then remove the Teflon tape from our restoration somehow. And get ready for cementation. But you can see that this fits perfectly onto the jig here. Okay, so now although we usually like a small amount of cement in the crowns, many times the assistants tend to fill the crown all the way up. And on a natural tooth, you have attachment of the fibers and you really don't get too much cement below the margins. So for the purpose of this, we're going to use Vaseline, and we're going to completely overfill this here. And then we'll go ahead and take it and set it down on our jig, and you can see how much Vaseline has worked its way out. And you can imagine if we did this in the mouth with cement for the first time, how much would get underneath the sulcus that we would have to end up cleaning. So we can wipe this off of our jig, which would be cement. We're wiping our cement off of the jig, and it has now left a very nice, perfect thin layer inside the restoration, which we can then put on the abutment in the mouth and seat down with minimal cement expressing out into the sulcus. And this is the best way to avoid excess cement around dental implants when cementing them. So you always want to try and fabricate a jig or an analog of the abutment to pre-cement it first. Thank you.